Hi everyone, my name is Talia and I'm part of the UNIFY Gather team. And today I'll be going over the Navigating Healthcare in British Columbia module today with you guys. And before we get started, I just want to mention that everything I'll be covering today will also be available in our app, which is now available in App Store. And let's get started. So before we dive in, we're going to look at the agenda. We're going to be going over the MCP eligibility, how healthcare works in BC, clinics versus ER, prescription and pharmacies, and mental health supports and activity and Q&A. So, understanding healthcare in BC. So how this system works is BC has a public healthcare system. This means healthcare is funded by taxes, usually do not pay when visiting a doctor or a hospital, and access is based on medical need, not income at all. So, what is MCP and eligibility? MCP is the Medical Services Plan, is a BC's public health insurance program. It pays for medical bills like doctor visits, hospital care, or emergency services. And MCP helps residents access healthcare without paying at the hospital or clinic. It helps pay for doctor visits, hospital care, and emergency services, so you usually don't have to pay out of pocket when you get basic medical care. And who's eligible for MCP in BC is international students who've been there for 6 months or more, work permit, work visa holders, permanent residents, refugees, protected persons, dependent of eligible permit holders, or BC residents. So what's covered in MCP and what's not covered? What's covered is doctors, hospitals, emergencies, like we discussed, and not always covered is dental, glasses, or prescriptions. Basically, something that's minor compared to a bigger injury like a emergency or like a fracture. So, what are MCP add-ons? Pharmacare. Pharmacare helps cover the cost of the prescription medications in BC. Coverage is based on income and medical needs, and most BC residents are automatically enrolled in it. Usually pay less for prescriptions when you're registered with Pharmacare. It works together with MCP to make medications more affordable for everyone. So which of these is covered by MCP? A, dentist, B, emergency visit, C, glasses, and D, massage. I'll give you guys a moment. And yes, it is B. MCP covers emergency visits. So who can apply for MCP if living in BC for more than 6 months? A, tourist visiting in BC, B, the international student for living in 6 months, C, work permit holders for living in like more than 6 months, D, permanent residents, E, B, C, D. I'll give you guys a moment to think. And yes, all of these apply. Everyone would need an MCP, international student work permit holder. Like everyone could apply for an MCP if eligible. Which of these do you think needs an MCP coverage? Seeing a family doctor, B, going to an emergency room, C, getting prescription medication, D, dental checkup, or all of the above. And yes, it is all of the above. All of these would need MCP coverage. Like seeing a family doctor needs one, or going to an emergency room needs one. Oops. So how to apply for MCP? What do you need to apply? So you need a valid study permit or work permit or PR card, depending on your status, and you need your BC address, passport or ID, and date you move to BC. So how to apply for this actually, we have two options. One is online, it's a digital application. It's the fastest and most recommended one. Or B, like the second option is by email and it's a physical form. It's print out the documents, fill it in, and mail it. Something important is the waiting period may apply before coverage starts. And during this time, private insurance is recommended because you need to have coverage for yourself as well. Okay, so where to find this form? Here's the link for it. And when you go to the link, there's going to be a section where it says apply for MCP Health Insurance BC page. And you click that. And then the steps after that in the form is putting in your personal information, name, date of birth, status in Canada, two, immigration details, study permit, work permit, PR, etc. And the third one, BC address, contact information, date you arrived in BC, and you upload your documents if you're applying online, like other ones, all of them, and then you review everything and then submit. Sorry. So what do you use during this waiting period? You use temporary private insurance because during this time you're gonna need some insurance if something happens or if something's possible to happen. So you can go and use Blue Cross, a school plan, or GuardMe until your MCP actually starts. So doctors, clinics, and urgent care. So types of cares that we have is like family doctors, it's more of long term. Your main doctor for ongoing care, checkups, prescriptions, and managing long-term conditions. So how do you find one? You register through Healthcare Connect, search online, or ask clinics if they're accepting new patients. And the other type of care is walk-in clinic, non-emergency, like for minor illnesses or issues when you don't have a family doctor, like colds, infections, rashes, etc. No appointment needed. You can find a walk-in clinics using Google Maps, Minimap, or HealthLink BC. There's a lot of places where you can find a walk-in clinic. The third one is urgent care. It's for more of a serious condition for problems that need quick attention but are not emergencies like sprains, minor fractures, or severe infections. And the fourth one is virtual care. It's more of online. You book your appointment by phone or video for advice, and you want to get a prescription referral or a follow-up. So, how to book a medical appointment? You call the clinic directly or book online through clinic's website or use apps like MediMap or TELUS Health. And for virtual care, you book through online platforms. So, where to go, like we've discussed, if you're feeling unwell, if you think it's life-threatening, you call 911 immediately. If it's serious, but it's not life-threatening, but it's an infection, like deep cut, you think it's serious, you call 911. But if not, if you think it's like a small cut, you go to your family doctor if you have one. If you don't, like it follows, basically. You could go to a walk-in clinic depending on what you have, or if it's a small, if you need advice, you call 811, which is Health Like BC for nursing advice, and so on. So you have a bad infection, where do you go? Urgent care. Urgent care is for stuff that's not emergent, not like ER emergent, like a chest pain, but it's a deep infection, like that is a deep cut, and you think something's gonna happen, you go to urgent care right away. So walk-in clinic versus emergency room. So when do we use each? Walk-in clinic is for cold, fever, minor injury, something that's very fixable very quickly. And ER is a chest pain, heavy bleeding, breathing trouble, basically life-threatening injuries. So if you have chest pain and trouble breathing, what do you do? And yes, you call 911 immediately, but if you think you can go by yourself to the emergency room, you go to the ER right away. So prescriptions and pharmacies. How prescriptions work is doctor prescribes it, pharmacy fills it, and pharmacist can help with anything depending on your prescription. And you go to Rexall, London Drugs, Shoppers Drug Mart, or Save On Foods Pharmacy and get your prescription. Can pharmacists help with minor issues? Yes, they can support you with common concerns such as cold, allergies, or minor skin issues, headaches, stomach problems, any medication advice that's very minor, like the ones that we've gave examples for. But if it's anything big, if it's not in their profession, if they don't know much about it, they cannot. But if it's any minor issues like these, they can definitely help you with it. So mental health supports in BC. Mental health matters. Adjustment is very hard when moving to a new country can be overwhelming. Many newcomers experience stress, anxiety, low mood during their first years in Canada, and support is available. Support exists, help is available through community services, clinics, and helplines. And you're not alone. Many people go through this, and it's okay to ask for help. Even if mental health feels stigmatized, it is important to talk about it and access support whenever you can. So when should you reach out for support? A, when you feel sick or in pain, when you're confused about the healthcare system, when you're stressed or overwhelmed, when you're not sure where to go for help, or all of the above. And yes, it is all of the above because when you're feeling sick, you should definitely ask for support. Or if you're feeling stressed or overwhelmed, you should definitely go for help and support. So when else could you reach out for support? When you're new to BC and unsure how things work, when something doesn't feel right and you need advice, and when you need help finding a doctor or clinic, and when you don't when you don't understand a medical bill or form and you need help filling them out. So here's the emergency and the resources that we have. 911 emergency calls, like police, ambulance, anything. 811, 811 Helping BC. It's a nurse advices line. You call them and ask. HealthThingsBC.ca, like we talked before. MCB website, you can find resources there on how to get your insurance. And calling 811 nurse advice, it's the first line since that's the most useful action-based resource. It's for more of like small issues, minor issues compared to like ER-based issues like chest pain. It's more of like less. So you can get help right away without going anywhere or waiting in line. So key takeaways I've covered today is BC healthcare, how healthcare works. BC has a public healthcare system funded by taxes. What MCP is, BC's healthcare insurance that covers doctors and hospital visits. And where to go, family doctor walk-in clinics for non-urgent cases, urgent care for same-day concerns, UR for emergencies, and emergency contacts, 911, police, fire, ambulance. Emergencies basically 811 Health Inc. BC nurse advice health info in general 988 suicide crisis helpline call or text 24/7 and 3106789 for non-emergency police calls in BC. And before you guys head out today, please follow our socials on Instagram, Facebook, and Eventbrite, and scan this QR code if you want more details about UNIFY, if you want to reach us, our website, or anything in general. And before you guys go today, please keep in mind that all of what I explained today will be on the app, on App Store called UNIFY Social. And thank you guys. Have a great day.